Hi, my name is Yolanda, and I'm the nurse that will be going through standard precautions and some of the other headlines that she mentioned in the beginning. So, standard precaution refers to a method of infection control recommended by the Center for Disease Control, or the CDC, in which all human blood and certain body fluids are handled as if they were known to be infected with HIV, hepatitis B, and other blood-borne pathogens. Handling all blood or body fluids, you would handle them all as if they're infected. You don't say, well, maybe this is not. You don't take those chances. You handle them all as if they are. Standard precautions apply to blood, all body fluids, secretions, and excretions, except sweat, regardless of whether or not they contain blood. Non-intact skin, this is if the skin is broken, and mucous membranes, and this could be in the mouth or middle ear, any of those areas where there's mucous membrane, that could be. Center for Disease Control and Prevention states that utilizing proper hand hygiene is the #1 method to reduce the transmission of pathogenic organisms and control the spread of disease. Washing hands is the most important method of infection control. Standard precaution is necessary. You can't always tell or know that someone may have a transmittable disease, and that's why you want to handle it all as if it is infected. Proper hand washing. You wet your hands with running water, apply liquid or powder soap. It really doesn't matter. Keep in mind that using antibacterial soaps, and you see these, sometimes they feel like this is better to use it, but it's not more effective in killing germs and may even lead to development of resistant bacteria. It's almost like taking an antibiotic for the wrong reasons, and then when you need it, you become resistant to it. You want to lather well, rub your hands vigorously for at least 20 seconds. Remember to scrub all surfaces, including the back of the hands, the wrists, in between your fingers, under the fingernails. They give you a little thing here. Imagine singing Happy Birthday, which should give you about 20 seconds, is what they're saying. I've never tried that. Proper hand washing. Rinse well with running water. Dry your hands with a clean or disposable towel or an air dryer. I've read that the air dryer is better than the towel. The reason I like the towel is, especially if you're using a facility, then you don't want to handle the door after you've washed your hands, so you use that paper towel to do that. Okay. Hand sanitizers. Only use alcohol-based sanitizers when there is no visible soiling. If there's nothing on the hand that you can see, you can use those. And you'll see them everywhere, almost any place, even in the grocery stores. Apply the product to the palm of one hand, rub hands together vigorously as if you were washing with water. The same procedure. The wrist, the back of the hand, and between the fingers, under the nail, until the hands are dry. Handling bodily fluid. Bodily fluid comprises blood, vomit, or any fluid with blood in it. When handling, the caregiver must use disposable, non-porous gloves, disposed in a sanitary manner after one use. Wash hands in running water after using and disposing. Dispose body fluids according to local regulations. Dispose sharp items and hard plastic away from children. In your gloves, and I'm sure all of you have used these before, you sometimes I can't put these on. But the way what they're telling you to handle them, dispose of them in a sanitary manner. Okay, imagine I've got these on, okay? They're not cooperating. And they're not sterile, so it doesn't matter, you can have them on. And so you're done taking care of dressing a wound or something like that, and you want to take them off. So you take one off, and you put it inside the other one, and then pull the other one on top. That way you're not handling those gloves, and toss it into a receptacle. Okay. Let's see. Dispose of sharps, needles, syringes, and lancets. And these could be if you have a child that's diabetic, or they're on medication for asthma or allergies. And so It says dispose of sharps. That would be your needles or lances if you just want to prick the finger to do a diabetic check. Put sharps in a sharps container immediately after use. Syringes with attached needles should be disposed of with the needle still attached. You don't want to take that needle off to prevent from sticking your fingers. Do not try to remove, bend, break, or recap the needle. If you do not have a sharp container, put the items in a puncture-proof plastic container. Tape the lid closed. Do not use a glass container. You can use milk cartons. You can use anything that the needle cannot puncture through. Seal it, and it can be thrown in the trash along with other trash. It doesn't have to be in any particular trash can. Now, if you're in a facility, it's different. They'll have a red bag container that you would put certain things in. But in the home, you just want to make sure that it's taped closed. Store the waste container safely away from children. Put the sealed container into the center of a full, preferably dark trash bag and throw it out with the regular trash. That's the key point. It can go out with the regular trash. Never put any type of sharp container in the recycle bin. Dispose of soil or bloody items, gauze, gloves, and bandages safely. Put the items in a sealed, leak-proof plastic bag. Put bags in the regular trash. Use trash barrels with tight lids to avoid attracting animals, and that's a good point. Even for your own home use, if you're putting trash out, you want to not put it out the night before, maybe early morning, because the animals will attack it, especially if they smell food or blood or any bodily fluids, they will attack that. Disinfecting and sanitizing your home. Disinfecting, destroying, or inactivating most germs on any inanimate surface. Appropriate for use on non-porous surfaces such as diaper, change tables, countertops, door and cabinet handles, toilets and sinks used for toileting routines, including faucets, knobs, and basins. When disinfecting items, wear gloves. Wipe away any visible contaminant, spray with bleach solution, and allow it to stand 2 minutes before wiping or let it air dry. Then remove your gloves and wash your hands well. Remember, bleach is a hazardous substance. The difference between sanitizing and disinfecting. Sanitizing reduces germs or inanimate surfaces to levels considered safe by public health codes, appropriate for food contact services like dishes, utensils, cutting boards, high chair trays, tables, toys that children may place in their mouth. This would be sanitizing. You're not actually destroying what you are reducing them, okay? Again, on the differences between sanitizing and disinfecting, all surfaces that come in contact with body fluids or possible cross-contamination must be treated appropriately. Items to be sanitized must be washed for 5 or more minutes in a machine that uses hot water. It's in 160 Fahrenheit. The only thing I know that will do that will probably be your dishwasher. You don't want to put your hand in that hot water. Or a 3-compartment sink deep enough to completely immerse items for soaking, rinsing, and disinfecting. Well, you see this in hospital facilities or in restaurants where they'll have a 3-sink compartment where you'll wash and rinse and then disinfect. In a home, you're probably not going to have that. Number one, it would be in a dishwasher. Most of us have dishwashers. If they don't have a dishwasher, my suggestion would be to use either a pot of boiling water or a tea kettle that will get it to boiling. After washing it with the bleach solution, then I would immerse it in that hot water. That would be the comparable to a 3-compartment sink. Okay? Does that make sense? Sanitizing solution, how to make this. Okay, you're going to mix 1 tablespoon of bleach with 1 gallon of water. That's to sanitize. Remember, you're reducing the germs on this. To disinfect, but you want to actually get rid of that, the solution, you're going to mix 1 tablespoon of bleach with 1 quart of water, which makes it a stronger solution. Okay? Again, remember that bleach is hazardous. The difference again on sanitizing and disinfecting, a special note. Always clean the visible debris from the surface prior to sanitizing or disinfecting. Spray or wipe with surfaces with the disinfectant. Make sure to allow surfaces to fully air dry. So if there's visible debris on it, you want to rinse that off before actually sanitizing, okay? Administering medications, we're moving right along here. A medication can include any substance taken into or placed on the body to do one of the following things: cure a disease, such as an antibiotic, treat a condition, an anti-seizure medication, or relieve a symptom, an allergy medication, or prevent a disease. And vaccines, we know about those, even in early childhood, they have their vaccines, or the flu vaccines. Now those going off to college, they need the meningitis vaccine. The routes of medication, or how they're taken, includes by mouth or topical, which includes transdermal, like an ointment, ear, eye, and nose drops, and inhaled medications. These are methods of giving medications. The transdermal, those are ones that are absorbed through the skin. In administering medication, you want to obtain a written prescription from a licensed physician. Make sure you understand how and when to administer the medication before you leave the physician's office. Ask questions to ensure understanding. Make sure that you have the physician or office staff complete the appropriate agency form. Provide the agency health record forms to the youth case manager or medical coordinator. Take verification of the youth's health insurance coverage to the pharmacy. Contact the child's case manager or medical coordinator if you have trouble filling the prescription. One thing you want to make note of here, this form that you need, you want to make sure you have that, because that has to be completed by the physician. Vanessa has a copy of that that she'll pass around, and take a look at that and see exactly what that looks like. And it's important to take the verification of the youth's health insurance coverage. You don't want to get to the pharmacy and can't get the medication because they can't find them. Sometimes they can find them in the system. You want to have that card. There may have been some changes from the last time that they were taken to the doctor and had medication to be filled by the pharmacist. Okay? And if you all need to go over those forms and take a look at them in the breakout session, you can go, that can be taken care of. Medication administration continued. Fill the prescription at your local pharmacy where they are required to provide an information sheet about the medication. This is important. Most of your pharmacists will provide that information sheet. If you've ever taken a prescription to the pharmacy, there's a sheet that comes in. It tells you side effects of that medication. It's important to have that. It's important to make note of it. It's not something to be afraid of. It's just to be aware of, because you're giving a medication. All medications are synthetic drugs, and so there is a possibility that you'll have side effects. Familiarize yourself with the possible side effects and adverse reactions to the medication that are listed on the information sheet. Report any label errors immediate to the pharmacy and have the label corrected. You say, what's a label error? They could have typed the name incorrectly. They could have put the wrong label. The pharmacist is filling prescriptions and put the wrong label on that. So you want to make sure the physician has given you the prescription. You want to make sure it says exactly what he told you, because you're going to ask questions before you leave the physician's office, okay? So you want to report those immediately to the pharmacy and have the label corrected. That means you're going to check it before leaving that pharmacy. Store the medication in an original container or request a second duplicate label container if needed for school. Many times children are on, especially on medications, you see a lot of them for ADD and ADHD. They need to take one in the morning, and then maybe at noontime with lunch they need to take a second one. Both containers need to have the exact same label, and it's usually turned into the school nurse. Okay? PRN refers to a Latin phrase, pro rata, meaning in the circumstances or as the circumstances arise. The term PRN is commonly used as medicine to mean as needed. and that's what you'll usually see. You won't see pro and nada. You may not see in the circumstances, but you will see as needed. And it's differentiated from medications which are given on a routine schedule. If they need to have a medication twice a day, every day, or once a day in the morning or with breakfast, that's a routine that you're going to give every day. If it's for something that's just a short term, they're having sinus issues, and it's taken as needed for those, and once it's cleared up, then you will stop that. Prescription PRN medications might include cough medications, asthma medication, or anxiety medications, and they're only given as needed. When the cough stops, then you stop the medication. When the asthma symptoms are relieved, then you stop the medication. Over-the-counter or OTC medications do not require physician authorization, but they must be administered according to the instructions and dosing on the FDA-approved label. Tylenol for a headache and Imodium for diarrhea. And many times, the physician will write these prescriptions, even though you can purchase them over the counter, and because it depends on their insurance. If they purchase it over the counter, it may cost them more, in opposed to using their insurance card, and it will be a benefit through that. And that's why you'll see it as according to the instructions. Over the counter, it may say one way, but the physician may say, instead of giving it to them once a day, it's fine to give it to them twice a day. Over-the-counter meds do not need to be labeled for an individual child, and the dose of over-the-counter meds for different children may be dispensed from the same container as appropriate for their age and size. So if you're giving a cough medication, and it says on there, if they're 3 to 6 months, which I doubt they will do, I'm just making up a general example, then you would give the appropriate dose. And then if you're giving it to a child with, say, 2 to 6, then their dosage may be different, but they can take the same medication. That's what's meant by this. Never borrow medication from one youth to give to another. Never allow a child to administer medication to another child. If you're in prescription medications and over-the-counter medications together, check the medication information sheet of the prescription for any drug interactions, and that could well be. Some medications can't be taken together. It's not that they can't have it, you just can't give it together. You may need to wait an hour later to give the other one. Document the medication administration on the appropriate medication log. And if you have a child that is on medication, you're going to have a specific log where you're documenting. I always make note, if you don't document it, then you didn't do it. So you have to document it. A chart or any document of that sort is considered a legal document and can be used in a court of law. So you want to make sure that you document it, okay? They would go over those appropriate forms in your breakout sessions. Prepare the medication as ordered and administer the medication immediately after preparation or within 1 hour. If you prepare the medication and get distracted for some reason, something has happened, you need to go off and do something else, and it sits there longer than an hour, then you don't want to use that medication. Administer medication for only one youth at a time, ensuring that you are preparing medications for the correct child and the child receives only the medication prescribed for them. And that can happen. You've got 2 or 3 children and you're trying to pour them all up at the same time. You could get distracted and, oh, did I put it for that one? Did I do this? You want to do one at a time, and that's very important. You don't want to give the wrong medication to the wrong child. Try to ensure that the youth took the medication, and do not force a youth to take a medication. Got some special notes on that I want to share with you guys on this. To try to ensure that they take the medication, but do not force them. If the youth refuses a medication, document this on the medication log by writing refused for the dosage. When you were in a place where you would give dosage, you put refused. Complete an incident report, notify the appropriate parties, IFC with the case manager or on-call, phone, or ACT medical coordinator and program. In special circumstances, such as an allergic reaction or a seizure, may require administration without consent. If the child is having a seizure, they can't say, no, I don't want it. So that would be a special circumstance. An EpiPen, you just need to inject, you need to get it in, instead of if you ask, do you want this medication, you need to get it. Infants and toddlers may need assistance taking the medication with an oral syringe. If they seem resistant, talk to the prescribing physician about options. What else can we do with it? Maybe mix it in food. Many times you'll see them do puddings or applesauce or adding flavor to it. Pharmacists can do that sometimes. They'll ask for if the child likes strawberry or if they like grape. The pharmacist can do that with some of the medications, okay? And this will make it easier. Older children cannot be forced to take medication. You just want to make sure you document. That's important, that is documented. Medication effects. A desired effect is therapeutic. It's doing what it's supposed to do. You're giving the medication for whatever the illness is, and it's doing that. You're seeing the results of it. That's a desired effect. Side effects are reactions secondary to the one intended, and a more common effect is the antipsychotic medications, and we'll talk about those a little bit further on. They commonly produce what's called extrapyramidal symptoms and side effects. They do just the opposite of what you expect them to do. They include acute dyskinesia and dystonic. This is like jerking motions that you're not really expecting to see, and that's why it's important to know the side effects and know if one medication contradicts the other. Adverse effects, uncommon or unexpected harmful and undesired effects resulting from a medication, not necessarily dose related. Well, maybe I gave too much. Not necessarily. Sometimes that happens. And you want to go back to that physician to ensure that this is one that the side effects is just too abrupt, it's too much. And so the doctor may need to change that medication that will give them the same effect, but one that is appropriate or this job can handle. Some known possible side effects are listed on the medication information sheet. That's that information sheet, which is so important. Examples would be stomach aches, drowsiness, dizziness, sleep problems, tremors, weight gain that may occur with starting a new medication or increasing the dose or stopping the medication. Stomach aches is a major one, and sometimes children will learn that and they'll use that as an excuse, but you need to know the child. You need to know them, okay? Side effects may get better with a healthy diet, with rest and exercise. They may interfere with function. Caregivers with YS staff, foster parents, should report any observed side effects. You want to make sure that you're being on top of what is happening so that changes can be made. But be aware that making changes to medication doesn't happen immediately, and especially if they're on a psychotropic medication. You don't want to take them off one and immediately put them on another. So if they're on a psychotropic, that means you may go for a period of time without them being on anything, which could make your job a little bit tougher. But individual side effects on child communication logs, ACT or monthly reports. The medical consenter should report to the physician's office within 72 hours. No client incident or accident report is needed. The medical consent info will be covered later in the training, and that will happen in your breakout session. I'm sorry I missed both of those points. The top part is this: it may get better with healthy diet, rest, and exercise. It may interfere with functioning. Who should the foster parent report concerns to? Who should the YIS staff report concerns to? And that's here, the medical center or the physician's office. Adverse effects. They're uncommon, they're unexpected, they're harmful and undesired effects resulting from a medication, not necessarily dose related. They may be cumulative toxic effects, and that's why we monitor drug levels. Some medications, they have to have their blood level checked to make sure that it's not becoming toxic or affecting their liver, which may range from mild rashes to life-threatening anaphylaxis going into an immediate shock. That may cause medical complications of a disease or negatively affect its prognosis. There may be an allergic reaction, again, the anaphylaxis, which could be really severe, are likely harmful and life-threatening if the child keeps taking the medication. Again, the side effects are so important. Paradoxical effects. Unintended, drugs work in opposite ways expected. Benadryl is a popular one. Sometimes you get itching from maybe getting bit by ants or something, mosquitoes, and they're having itching, and you use Benadryl. Some people get agitated and not drowsy. In most cases, people get drowsy, but instead, this paradoxical effect causes them to become agitated, and so that's something you need to be aware of. Interactions can occur between medications. 2 or more drugs given together may produce a stronger response, sometimes intended, sometimes not. And that, if it's intended, you would know that from the physician. He's wanting to get that increased response, okay? 2 or more drugs given together may cancel each other out. And so, again, you need to know that up front on the medication. Most pharmacies are pretty good about doing labels indicating how you should take them, if you need to take them with food or without food, okay? Interactions can also occur between foods and medicines, and that should be listed on your label also. Milk or grapefruit juice. Grapefruit juice is a popular one. Most of your synthetic drugs, you're not to use grapefruit juice. It just kind of annihilates that medication. If you believe a medication is not showing any effect, or if any symptom is unusual or unexpected, report it. It's not your responsibility to figure out what's wrong with the child. That's the provider's responsibility. If you see they've been on this for a while, we're not getting any response from it, we're not seeing any progress from it, then you need to report that. If you believe that a foster child is experiencing an adverse reaction, you should call the prescribing physician or call 911. In bold letters, do not call case manager first. You want to get them cared for initially. You can call the case manager afterwards and say, we're at the hospital, this is what's going on. And make sure you document. Follow up with the physician as directed. Continue on adverse reactions. Remember to report this information to appropriate parties and the child's treatment team. Contact the case manager, your supervisor, or on-call staff as appropriate to report the critical incident. Have the details to include in the report, including the prescribing physician's name, the contact number, the date and time of reaction, date and time of physician's contact, any recommendations suggested, and any actions taken. So it's important that you document it, because if you get them on the phone, you want to have all this information handy so that you can report that. You know, like, oh, I don't remember what time it was. So, document the incident along with any follow-up instructions. Provide updates on the client's condition. Now we go to the fun part. Psychotropic medication. Medication prescribed for treatment of symptoms of psychosis or other mental, emotional, or behavioral disorder, and is used to exercise an effect on the brain and the central nervous system. So remember that that's what's happening. So there may be some adverse actions going on, but because this medication is affecting the central nervous system, and it'll modify their behavior, their cognition or understanding, or their affective state. You're looking at them and seeing them in a different manner. And that's to treat the target symptoms. The psychotropic medication changes the way chemicals in the brain, neurotransmitters send messages between brain cells through a synapse or process. That's a lot of big words, but it's still the central nervous system that's being affected. They include the following categories: psychomotor stimulants, antidepressants, antipsychotics or neuroleptics, mood stabilizers, agents for control of mania or depression, anti-anxiety agents, and sedatives, hypnotics, or other sleep-promoting medications. That's a lot of medication, and to think that children are on these is really hard to even imagine, but many of them are. You have to realize some of them, the trauma that they've been in. Many children in a community, meaning they're out of their home, care never need psychotropic medication. That is so great to hear. Children who are traumatized by abuse, neglect, or separation may show negative behaviors or signs of emotional stress that are a normal reaction to what they've been through. Also, all children act out at different stages of their life. For example, 2-year-olds commonly have temper tantrums, and teenagers often rebel. So it's not always the medication in some of their actions. But some children need medication to cope with the trauma of abuse, neglect, or separation. Other children need medication to treat behavioral health disorders that they inherited or developed, such as attention deficit hyperactivity disorder or severe depression or psychosis. And this will develop because of the trauma and the stress, and it's the way their body functions to handle some of the trauma they've been through. Psychotropic medications may help children function at home, in school, and in their daily lives. They may need these medications temporarily to treat emotional stress or long-term to treat lifelong behavioral health disorders. And that happens in some cases. I won't go through all of these psychotropic medications, but if you look at the very top, ADHD is number 1. And you find it, I've worked with, my last job before retiring was for pediatricians, and a large percentage of the children were on medication for ADHD. And when you look at the fact that it's caused by probably severe depression or trauma, you wonder what is going on in some of these families, and not necessarily foster care, because of our lifestyle in these later years. Both parents are working, stress in the home. It could be many things, but that is number 1. Conduct disorder, oppositional defiant disorder, anxiety disorder, bipolar disorder, obsessive compulsive disorder, and PTSD. These are some of the disorders that psychotropic medications are needed. Stimulants. These are examples of short-acting stimulants. And I mean they're only for a certain number of hours, usually 4 hours. Amphetamine, you'll see listed as Adderall. Dexamethasone, Focalin. Methylphenidate, Ritalin, which is an old one that's been around for a long, long time. Metadate and Methylin. Dexamethasone, Dexedrine, Dextrostat. Those are short-acting. Examples of long-acting would be, if you'll notice, the names are exactly the same, Adderall, but it's XR, which is extended release. The Focalin, XR. Methylphenidate is now called Concerta, and these last longer, up to 8 hours. And Vyvanse. Vyvanse is a pretty new one, and I find a lot of parents in the practice that I work in, they wanted that one because it's not as great a stimulant as some of the others, like Adderall. And unfortunately, some of the children can get off of them. They go off to college, and you find it keeps them focused, so they want to continue taking it so they can pass exams in college. These are commonly used to treat attention deficit hyperactivity disorder, or ADHD. Symptoms of ADHD may interfere with functioning at school and in daily living, and may include short attention span, inability to stay still, or being impulsive. They may be short-acting or long-acting. Short-acting act right away, but do not last a long time. Long-acting takes longer to act, but it lasts longer. So if they're needing it for school hours, parents may need to give it to them earlier before they leave home to go to school, so that by the time they get in class, it's working. Some children may take short-acting and a long-acting stimulant to get coverage throughout the day. Taking a short-acting and a long-acting stimulant together counts as only one stimulant and is not outside the parameters. You may think, gosh, that's an awful lot for that kid. But here, especially in Texas, a lot of kids do sports or music or dance or something after. So if their medication is going to take them throughout the school day, they're out of school 3, 4 o'clock, and then from 6 o'clock to maybe 8 o'clock, they're doing something. They need that additional one to keep them focused for whatever that activity might be. And so that may be happening. Adverse reactions, these are the ones that you're not expecting. Sudden death in children with pre-existing serious heart problems, high blood pressure, problems with growing, such as a slower growth rate. And that's interesting, especially with boys. You'll see the parents come in and say, well, my boy's not growing, you know, he's 12 years old. If he's on this medication, it may slow him down, not necessarily not grow, but it'll stunt him just a little. Side effects, these are ones that can be expected. Again, you've got synthetic meds that were taken, would be decreased appetite, weight loss, headaches, stomach aches, trouble getting to sleep, jitteriness, social withdrawal, tics, these are sudden repetitive movements like tapping their fingers, tapping their feet, aggressive behavior or hostility, psychotic or manic symptoms. Weight loss is one of the major ones you'll see because they have a decreased appetite. And so what you'll find some parents, what you can do is not give it to them on the weekend. Now you've got this overactive kid running all around the place and not being focused, and maybe you want him to clean his room or a room on the weekend. But you want to give them a break so that they can eat, because they will lose weight. They will have trouble getting to sleep if they're taking a shorter active one in the evening because they're playing sports. So these are things you have to deal with when they're on those medications. Stimulants are usually the first medication tried for ADHD. Sometimes antidepressants are given for ADHD if 2 to 3 stimulants are tried and do not work. Doctors should start the stimulant at the lowest dose, and only to increase the dose is needed. Short acting lasts for about 4 hours, as I told you, and long acting can be up to 12 hours, from 8 to 12 hours. They may start with 2 to 3 stimulants and find out that they don't work. But in between that time, there's going to be periods when they're on nothing, because you can't go from one to the other. It takes time to get it out of the system to make sure that the next dose, either higher or lower, is the effect that you're looking for. Examples of medication, and these are some of the many ones you'll see on the market, and I've seen parents try them all. This is not working, they're not eating at all, whatever's going on. They're not sleeping, they're irritable, and so doctors will change them. Clonidine is used to treat high blood pressure in adults, but it causes sedation in children in small doses. Guanfacine, or Intuitive is one that you'll see, is used to treat high blood pressure in adults, but causes sedation in children in small doses. Strattera, this is another new one that is not a stimulant, okay? It's a newer antidepressant. In rare cases, though, it causes suicidal thought risk. Suicidal thought risk happens in that medication, but many times they don't have a plan, and that's why you want to have open communication. What's your plan? And if they have a plan, they need to seek some help, okay? Wellbutrin SR, or extended release, they are newer antidepressants. But antidepressants work for children with ADHD. Tofranol is another old one that's been around. It's an older antidepressant. It's usually used to treat bedwetting, but can be used to treat ADHD. So there's several medications, and it depends on that child. It depends on their makeup, and how they're handling that medication. Symptoms of depression may include feelings of hopelessness or helplessness, loss of energy, changes in appetite, weight gain or weight loss, not being able to enjoy activities the child used to enjoy, or thoughts of suicide. Feeling of hopelessness or helplessness is one you really need to deal with, because they may be going from one foster home to another, and they may feel that. Antidepressants help with other conditions, school phobias. Maybe they've changed from school to school because they moved from one foster family to another. Panic attacks, just afraid of the new things that are happening. Eating disorders, autism, ADHD, bedwetting, anxiety disorders, obsessive compulsive disorders, OCD, you hear that a lot, and many of us say we hear those. I think we do. Post-traumatic stress disorders. You hear that a lot, especially with military people, because of the stress and the trauma that they've experienced. Personality disorders and sleeping problems, and antidepressants are used for those. Several classes available are SSRIs and SNRIs, and it just means how it acts on the central nervous system. It may take a couple of weeks to work. A 2-week break, which is what I mentioned to you earlier, may be needed after finishing one medication and starting another. A child should never stop taking an antidepressant suddenly. They have to be slowly weaned off. In the same way, when you're increasing, you want to titrate a little at a time, not large doses. Doctors will help wean children off medication slowly. This will help prevent dizziness and other side effects. They may need to be off of it, but if you do it abruptly, again, you're dealing with the central nervous system, which could affect them. Antipsychotics, they may be used to treat a number of conditions in children: psychosis, bipolar disorder, schizophrenia, autism, Tourette syndrome, and severe aggression. They're divided into 2 groups, atypical or second generation. These were ones that were developed in 1994. These are later ones called second generation. Typical are first generations. These are antipsychotics which were developed in 1950s. As I said, some of them are pretty old, and they've been around a long time, and they've been pretty substantial. And for a lot of people, the doctors will use those because they have proven effects. If they're not working, then they begin. I know you watch television. It's just horrible when they introduce a new medication and they tell you all the good things about it, and then they say, but it could cause this and this, and it's like, why would I want to take that? Other information on antipsychotics. Each child is different. So a child may need to try different medications in order to find the one that works best. You should start seeing positive changes in 2 to 3 weeks, but it may take 6 to 8 weeks. That's a long time to deal with a child who's not focusing, who's disruptive and not doing well in school, the whole 9 yards. A child should never stop taking antipsychotics suddenly. This may cause fast changes in mood, agitation, aggression, nausea, sweating, or tremors. The child's doctor will help you wean the child off the medication slowly. This is being repeated because it's very important. The child's weight, their glucose or blood level, and lipid levels should be monitored regularly by a doctor while taking antipsychotic medications. Again, they want to check those levels to make sure that they're not becoming toxic. And sometimes that happens, that start just hit me, if their appetite is poor and they're not excreting on a normal, regular basis, that can happen. Mood stabilizers used to treat children with mood disorders, such as bipolar disorder. Children with bipolar disorder have extreme mood swings. They're either manic and they're just doing lots of things that they shouldn't, or they're depressed. They don't want to do things that they generally do. When children are in a manic state, they may be very active, talk too much, have a lot of energy, and sleep very little. They may also be angry, irritable, or feel overly self-important. Children in a depressed state may feel hopeless or helpless, have a loss of energy, have changes in appetite, gain or lose weight, not enjoy activities the child used to enjoy, and have thoughts of suicide. Years ago, I did home health nursing, and I had a client that was manic depressive. And I would go some days and she'd just be so down, and she didn't take her medicines and didn't want to take it. And then one day, I would see her like twice a week, so I hadn't seen her in a few days, go back, and she was not at home. She was on the corner of her house. She'd gone to one of these like inexpensive shoe store and bought 100 pairs of shoes and was sitting on the corner selling them. That's the manic state. I'm like, gosh, this is really sad. Some medications used to treat mood disorders are also used to treat seizure disorders. If it's used to treat seizures, it is not considered psychotropic. This child does not have a psychotropic illness or need for that. It's because they're having seizures. And some of the medications that are used is called Lamictal or Depakote and Tegretol. Those are old ones that's been around for a long time, and they work. Medications that are only used as mood stabilizers is lithium. And many people who are on lithium that need it, they won't take it. And so you'll find them swinging from rafters if they can get up there. Mood stabilizers may affect the metabolism, the liver, the kidneys, and the thyroid. Children taking Tegretol, Depakote, or lithium should have routine blood levels are usually checked in the morning before the medication is given to the child, so you would avoid giving that medication before taking it in to have the blood samples. Tranquilizers are used to treat people with severe anxiety that interferes with their daily activities. The benzodiazepines are potentially addictive and are more commonly used in the hospital. However, they may be used to treat neurological problems in children, such as muscle spasms. And examples are benzodiazepines, Klonopin, Ativan, and Xanax. And Xanax is a very popular one. A lot of times people on Xanax, because others want them, because of the high it gives them, they'll sell them. Supportive environment. Most children, and this is where you guys come in, particularly in this number of you tonight as a caregiver, foster care parents, they will heal with stability, consistency, nurture, and support knowledgeable of trauma-informed care. When you understand what's going on with that child, they can heal. This means that the caregiver is patient, understanding, kind, loving, and gentle. Even if they're a 2-year-old that's being a 2-year-old, even if they're a teenager that's just being defiant, they need this. It gives clear instructions about expectations and house rules. It gives consistent consequences when rules are broken. It teaches the child coping skills and how to control their behavior and emotions in an age-appropriate way, and praises the child for positive behaviors. Consequences have to be real. Don't make promises of something you're not going to do. And if you say this is the consequence for not doing this or for doing this, then you need to follow through. Children may act out as they adjust to a new home and learn new routes. Caregivers should expect that adjustment takes time and give appropriate support and acceptance. If given safe, positive, nurturing, consistent, trauma-informed care, most children will learn to trust, feel safe, and learn to control their emotions and behavior in a way that is appropriate for their age. So it all depends on the caregivers. Whether you're a foster care parent or if you're staff, YIS, wherever your role is. You as respite, going in and respite is there to give the foster care parent a break. They need to have a continuance in that care. Non-pharmacological interventions. This is caring for a child without giving them the psychotropic medication. Specific methods a caregiver can use to help a child manage behavior. Psychosocial therapies, specific behavior modification strategies, and other non-pharmacological or non-medication interventions are to be considered by the medical consent. And that's the one who is in control of giving the medications or making that decision, before or along with psychotropic medication. Each child is different, so the strategy should be specific to the child's needs and discussed with the child's therapist or medical provider. And you would know them one-on-one, what's going on and what should be appropriate and the method that can be used for them. They may need both for a period of time and then can be taken off. That can happen. Behavior intervention or trauma-informed care training. This is required for all ACT and IFC staff carers and is completed during pre-service training as well as annually. Working with the child's treatment team and other school staff to find interventions that work and make sure everyone is using the same intervention. Consistent interventions and consequences help the child learn to manage his or her behavior and emotions. I have a special note here for you. Who is considered part of the treatment team for ACT? The therapists, YS supervisor, program managers, and federal field specialists for undocumented children clients. For IFC, involve the foster parents, case manager, therapists, program managers, and federal field specialists for undocumented children clients. Psychiatric evaluations, what the psychiatrist will do. talk to the child, talk to the caregivers and medical consenter, review medical history. If needed, get laboratory studies such as blood tests or EKGs or electrocardiograms. The medical consenter is something that will be discussed in your breakout sessions, but this is usually the case manager who makes the decision that this child needs this medication or doesn't need it, and then passes that on to the foster care parent. If needed, get special assessments such as this is what the psychiatrist will need. A psychological evaluation, which is a mental exam and testing by psychologists. An educational assessment, which helps find out a child's ability to learn material at an appropriate age and grade level and the best way for a child to learn. Speech and language evaluation to assess the child's ability to understand language, express him or herself, and speak clearly. He's to give a diagnosis and recommend the best way to treat the child, such as therapy or psychotropic medication. Additional information the psychiatrist will need to know. Description of the child's problems and symptoms, information about health, illness, and treatment, both physical and mental, including current medications, parent and family health and psychiatric histories, information about the child's abuse and neglect history. Caregivers have crucial information to share, YS and foster parents. So a child's treatment including the healthcare providers. This is information they need to know. So if there's things that you know about this child, you need to tell the psychiatrist so that the right decisions can be made as to whether they need medication. Back to the last one on the school, there's help for these children in these classes if they're not doing well. You want them to stay in the mainstream, but they need assistance to going through their classes. We'll have a big job. What the psychiatrist will need to know: information about the child's development, information about school and friends, information about family relationships in the child's birth family and current home or living arrangements. It is important for a child's caregiver or medical consenter to find out as much of this information as possible before taking the child to the psychiatrist. The psychiatrist needs to know how the child is doing in all areas of his or her life. So if it's got the need for psychiatric evaluation, you need to have all this information up front when you go to the psychiatrist so that the proper diagnosis can be made, proper medication can be ordered. The caregiver, parent, or staff should be diligent while working with the medical provider to get answers to questions about medication and therapy, find treatment that help the child get better, determine what treatment is in the best interest of the child. And this is something that you can make a decision based on the length of time you've been with their child, knowing that this is the best interest for them. Disparate health treatment. The medical consenter, along with caregivers, should be aware that stereotypes and biases about race and ethnicity may impact clinical assessment in mental health care, and should discuss with the doctor whether the child's assessment, diagnosis, or recommended treatment has been influenced by factors related to race or ethnicity. That's so important because culturally some of the actions that's going on with that child may be because of cultural things that are within themselves, and not necessarily that something's wrong and they need a psychotropic medication. Well, that would be the medical consent or the foster parent or the case manager and whatever arena that they're in at that time and making that decision. Psychiatrists must obtain informed consent from the child's medical consenter before prescribing a psychotropic medication. That's why you need to explain what's happening and have all of this documented, some of the activities, some of the action, some of it's just normal for a child that age, and some of it is outside of that. So you want to make sure that this is happening before a psychotropic medication is given. The medical consenter must be given enough information to decide whether or not to consent for the child to have the medication. The doctor must also allow the medical consenter to ask questions. The process of understanding the risks and benefits of giving the medication to the child is a vital part of informed consent. You don't want to sign off that they need this if all of this has not been taken a look at. According to Texas law, your consent to giving a psychotropic medication is valid only if it is given voluntarily and without undue influence. Deciding is based on what is best for the child, not because of pressure to consent to the medication or treatment. This is going to keep them calm. This is going to work for them. Okay? It has to be that it's the best thing for them, not because you're influenced that this might work for them. The consenter receives information given verbally or in written describing the diagnosis and symptoms, a specific condition to be treated, how will it help, the beneficial effects on that condition expected from the medication, risk, the probable health and mental health consequences of not consenting to the medication, the probable clinically significant side effects and risks associated with the medication, and the generally accepted alternative medications and non-medication interventions to the medication, if any, and the reasons for the proposed course of treatment. This is what they have to give consent to. The informed consent must be obtained from the medical consenter for each new medication and for changes in dose. If the medical consenter is not sure whether to consent to the medication, he or she should discuss his or her concerns first with the agency treatment team. Involving children. Discuss all medications with children. Talk to the child in a way that the child can understand. Make sure the child understands why he or she is taking these medications. This includes benefits. How is this medication going to be good for you? The risk, the side effects, and the consequences of refusing the medication. And so you want to have that discussion with them and not just say you need to take this medication. Tell the child what he or she can expect from any test or treatment. And again, we'll go back to one of our other slides. They can refuse it, and you not to force it on them, unless again if they're having a seizure. Involving the child helps children feel more in control and it builds trust. It may help make the treatment more successful. It helps children learn to make medical decisions as adults. Children should have more input into decisions about taking psychotropic medication as they get older. However, the medical consenter, that's the one who's giving the approval to give that medication, should always make the final decision based on what is best for the child. And that's good statements there. It makes the treatment more successful when they understand why they need this and what is it going to do for them. Remember that psychotropic medications are only one strategy to help the child. The caregiver must continue to provide a stable environment and consistent behavior intervention and explore non-medication interventions with healthcare providers. The child may also need behavioral health therapy. This is important, especially if they're doing both non-medication and then doing psychotropic medications, and there's a possibility that they can get off of it. So this is one strategy that will help that child. A child prescribed a psychotropic drug should have an office visit with a prescribing physician, the physician, or an advanced practitioner at least once every 90 days to allow the practitioner to appropriately monitor for side effects of the drug, determine whether the drug is helping the child achieve the treatment goals, and whether continued use of the drug is appropriate. Some things to tell the doctor about are changes in behavior, their mood, their appetite, or their sleep. And again, you're documenting these so that you can present that to the physician. Changes in how the child is doing in school. Significant things that are happening to the child. Example, a loss of a best friend or a major disappointment, termination of parental rights. This could cause some upset in them. Changes in how the child gets along with others. Suspect alcohol or drug use, weight gain or loss, or any side effects of the medication. These are some things to tell the doctor. All medical visits for ACT and IFC clients should be documented using the appropriate agency form. provided to the child's case manager, IFC or case manager, ACT. The IFC is professional health record form. The UC staff will upload client information to a portal, and these are done obviously on the computer. Seeking medical help. Always report concerns about the child's mental health to the child's case manager and your supervisor if you are an employee. All serious concerns, including threats or attempts to hurt self or others, should immediately be reported. If a child has serious symptoms or is not getting better with non-pharmacological interventions, the caregiver or medical consultant should talk to the primary care provider, who should refer the child to a mental health specialist. Anytime a child is a danger to himself, herself, or others, a mental health professional should be contacted. Examples include suicidal or violent thoughts or actions. Medication errors. Medication errors have the potential to be serious and must be treated accordingly. While an underdose of a medication may not cause permanent damage, an overdose can have life-threatening consequences. And that's another reason for pouring one medication at a time for one child to avoid distraction or avoid causing injury. Wrong medication, you're giving it to the wrong child, the wrong man, or the wrong time. A wrong dosage, too little. If you give an additional dose within 30 minutes, it's not a otherwise it's a medication error. Let's say you're supposed to give a teaspoon and a half, and you give 1 teaspoon and you realize, oh gosh, you're supposed to. If you do that within 30 minutes, okay, then you're fine. Otherwise, it is considered a medication error. 2 hours later, you realize, gosh, I missed that. Then it's an error, and it needs to be documented. Expired medication. Be especially careful with PRN or as needed and OTC, over-the-counter medication. Wrong medication, wrong child, wrong bed, wrong time would be considered wrong. But be careful with those that are, because you may hold on to those for a long period of time because they're only given as needed, and you want to make sure that they're not expired. Wrong time must be given up to 30 minutes before or 30 minutes after the scheduled time for compliance if it's a time medication. If they have to take it at a specific time, you can give it up to 30 minutes before or 30 minutes after that time. Wrong directives. If it's to be given with food, you should have been given, or should have been given on an empty stomach. You need to follow the directions. A missed or skipped dose. The child refuses, medication is not administered. That's considered a missed or skipped dose, and it needs to be documented. Improper storage, left out of the refrigerator. Now, today, especially some of the compounds, they don't have to be refrigerated, but some do. So you're giving an antibiotic, you're holding this child, and you're giving the medication and leave it on the counter, and overnight. It's left overnight, you can't use it. I've seen that happen. In most cases, the pharmacist will refill it and they won't charge them again. Documentation errors should be indicated in a consistent manner. When you realize you have documented an error, mark the error with a single line. You don't want to scribble through it. You don't want to blot it out. You don't want to erase it. You do a single line through it. Write the word error above the line with your initials beside it, and then write the correction near the error. There's a picture. Yeah, okay, so here we go. In the below example, the date, the amoxil, which is an antibiotic, was given as an error and should be July 29, 2014. And they documented June 29, 2014, given at 8 o'clock, 20 milligrams, and that's the initials of the person who gave it. The corrections is as follows. Draw a line through the error and write the correct date underneath. Your time and your dosage and your initials are on your quiz or exam that you're going to take after. They're not telling you to rewrite it. They're telling you to write it the way it is on the spot. Just draw the line through with the correct. So this, on the quiz, it's going to give you the right date. This the year is to be given on July 29th, and it's written on. They want you to show that in your quiz, the line through it, okay? That's important. And that's a correct way to document. You don't want to obliterate it. You don't want to erase it. You don't want to scribble through one single line so that the error can be seen. All medication errors requires immediate consultation with the healthcare professional. IFC, physician, nurse practitioner, pharmacist, ACT, quality control. Implement any instructions given to you by the healthcare professional. The healthcare professional may say what symptoms to look for in a drug reaction, or not to worry, and give the next dosage schedule, or call poison control, or any number of suggestions. Then take action and document the suggestions. You want to write it down. You want to document it and make sure it's dated in the time. That's important. Then call the ACT, the YS supervisor. It's after hours, call an on-call phone. IFC, you want to call the case manager or on-call phone. The case manager will assist you with the implementation of the instructions as needed and provide follow-up. Document by way of incident report within 24 hours. ACT staff must complete the incident report before the end of the shift. But IFC case manager or on-call staff member is responsible for completing and submitting an online incident accident report based on the information that you provide. Medication errors should be reported as soon as possible. Okay. And now you're ready for your breakout session.